routine trauma surgery. This has a high carcinogenic potential. Therefore, you must have smoke evacuators right at the source when the surgeon is cutting, so that the smoke which is arising from the tissue burning can be taken out and disposed of elsewhere through a high efficiency particulate air filter. Room suction systems can put at a much lower rate, but the key thing is on source, how do you take these gases out? So there was a WHO ILO joint estimate of the work-related burden of disease and injury. Diseases and injury are commonly clubbed together so that you have occupational health and safety being addressed at the same time. Formaldehyde is a gas which very many people use. Where do they use? Let us say you have a medical college and there are anatomy people who are teaching you anatomy. They are dissecting on cadavers. Formaldehyde is used to preserve the cadavers also. And you can be exposed to formaldehyde through that, and it can cause nasopharynx cancer, it can cause leukemia also. A lot of exposure at the workplace is to various respiratory related asthma germs. Gases or procedures which can cause you asthma, and asthma is one of the biggest cause of non-communicable disease in terms of occupational health. We heard a lot about long working hours. Many people say you should work for 12 hours a day, 14 hours a day, then the productivity will improve. That's all rubbish. There are studies which show that there are countries where people work only for 6 hours, 7 hours, 4, 5, 6 hours a day, and their productivity also increases. It's the quality of work which you do, it is not the quantity of work. But if you work really hard, then you can actually have stroke, heart disease and all. I'm not saying stop working, please work, but work diligently. And there's nothing like a 14-hour work hour at all. The people talk about work-life balance. I call it as work integration balance. If work excites you and gives you happiness, by all means do it. Then you will not feel the effect of work. But if work is a burden for you, a drudgery where you cannot contribute, then you need to wake up. I spoke to you about mental well-being as being one of the most important causes. Today, in terms of all the non-communicable diseases, cancers, respiratory disease and diabetes are the most common. And many of them have occupational origin. Gone are the days when we used to have asbestos. Now we don't have asbestos. So asbestosis, mesothelioma, cancer was very common. Exposure to benzene, bladder cancer was very common. There are so many substances at the workplace which can lead to cancer. And therefore, even as safety professionals, your MSTS will tell you what needs to be done. So that if there's a lack of information with your human resources or your supply chain people, you can actually tell them that we need to protect our employees against these substances. Tobacco use, physical inactivity, all those are very well known. Mental health challenge in healthcare workers. So there could be heavy workloads which cause high stress levels. Again, depression and anxiety I spoke to you about. I think we all need to understand that there is nothing wrong in having a mental health problem. The key thing is to tell your people that I need counseling, I need support. We need to help each other so as to prevent depression and anxiety. Burnout. Burnout means in the sense that you lose interest in everything which you do and you are fatigued even before you do it. That burnout happens because either you are not focused or your job is repetitive or you have a very toxic boss. Most people don't leave organizations, they leave toxic bosses. So if you have a toxic boss, please change your job. You can't change your boss. Yeah. Then post-traumatic stress disorder, which I spoke to you about. I'm elaborating a bit on mental well-being because we must understand that this is the biggest threat to the progress of the country in terms of productivity and in terms of our own physical and mental well-being. So the key components of protection against mental health is protection from harm, opportunity for growth, work-life harmony, and mattering at work. So this is also proposed by the US Surgeon General in terms of what you need to do at the workplace. What are the cancer risk factors for people at the workplace? One is chemotherapy agents, exposure to carcinogens from drugs, radiation, and infectious agents. What are the chemotherapy agents which can actually, while you are administering to patient, you yourself should be careful about? One is the alkylating agents, the platinum-based drugs, and anthracycline inhibitors. So these are various classes of chemical substances which can lead to cancer. People who work in the healthcare, they use radiation therapy for people suffering from cancer and all. And if you don't have proper protection, you can also be at a risk of cancer. And finally, infectious viruses such as hepatitis B, C, and HIV can increase the cancer risk. So the comprehensive cancer prevention for healthcare workers includes education, health screenings, and a supporting work environment. These are the conditions which cause the maximum number of deaths per year. Chronic obstructive pulmonary disease, all occupational, stroke, ischemic heart disease. So what do you do actually? Apart from the various preventive measures including periodical health checkups in place at the workplace, you must vaccinate all the employees. And this was during the time of COVID. We learned quite a lot during the time of COVID, like you need to have separate donning and doffing rooms, antibody testing and booster doses. Now why should a company invest in health? We have done extensive studies across the world and we have found in any country, whether it is Philippines, Brazil, India, as a part of Unilever, we did studies across the world. 45 out of the 100 countries were surveyed, and for every dollar, rupee or euro you invest, you get back 3 or 4 times. So there is a return on investment which is positive, and that's why we said that good health is good business. This is the Indian Medical Association and CDC USA guideline on vaccination, which you must give to all your healthcare workers. That is to do with hepatitis B onwards, up to rabies if required. If people are going into the rural areas where you have primary healthcare centers and offering services there, or other areas like deep tribal area, wherever there is a population of unvaccinated dogs, you must look at rabies in terms of pre-exposure prophylaxis. How do you prevent occupational health conditions in healthcare workers? So you implement an effective occupational health program and regular risk assessment, training, and finally the hierarchy of controls. And this will be a very familiar chart to all of you. The hierarchy of controls to prevent work-related health loss. The first should be elimination. Start with elimination. As far as possible, get the toxic substance, the chemical substance which is causing the problem out of the system. You can substitute it with something else which is less toxic. Then engineering control, isolating of workers from the risk factor. Administrative control, change how the people work. For instance, noise-induced hearing loss, if you have 90 dB level or 80 dB level for 8 hours, you may not have a problem. But if somebody is working at 100 dB and working for 6 hours, you may have a problem. So you look at the threshold. Somebody working at 100 dB where everything is failed, they probably move the person to something like 3 hours instead of 6 hours. So there's a various way of permutation and combination. Most important, of course, is to ensure that you are segregating the effect right at the very source. And finally, last is the personal protective equipment. Because PPE, you guys must be really tired of training people how to use PPE. They will not use it properly. That should be the last method. Strategies for preventing occupational health diseases. Most important is promoting a safety culture, regular safety audits, open communication, recognition of safe practices. Then you have health screenings which are job specific, identify early signs, and finally you have to have mental relaxation techniques at the workplace and organizational changes. So in terms of preparing this lecture, from my personal expertise and experience, having handled both health and safety at Unilever, NIOH, CDC, WHO, and all this were referred to in detail. So the organization will share a copy of my presentation with you. It's been wonderful to all of you, ladies and gentlemen. Thank you very much.